Hi, my name is Mackenzie, and I'm going to be talking to you guys about vaccinations. It's April 2019. Mayor Bill de Blasio of New York City announces a state of emergency for an ongoing measles outbreak going on within the state due to a lack of children not being vaccinated. We cannot allow these dangerous diseases to make a comeback here in New York City. We have to stop it now, Blasio said in a news conference. The order mandates that all unvaccinated children and adults living or working in the area must receive vaccinations unless they prove a medical exemption applies. Those who do not comply could be guilty of a misdemeanor or violation and incur fines. Measles is just one of the diseases in 2019 making its comeback. A pro: vaccinating your children and yourself will help both you from contracting a deadly disease, but also prevent it from spreading around the general population. A con: vaccines hurt, but what will hurt more is when you're laying in a hospital bed from an illness that could have been totally preventable. This outbreak is being fueled by a small group of anti-vaxxers in these neighborhoods. They've been spreading dangerous misinformation based on fake science. Health Commissioner Orxis Barbat said in a statement, "We stand with the majority of people in the community who have worked hard to protect these children and those at risk. We've seen a large increase in the number of people vaccinated in these neighborhoods. But as Passover approaches, we need to do all that we can to ensure more people get the vaccine." In doing my research, the most obvious question to come to mind is, what is the new trend in which parents decide not to vaccinate their children? A variety of factors came to play: religious and certain beliefs, freedom and individualism, misinformation about risk, and overperception of risk. State legislators and health departments now face a difficult challenge: respecting individual rights and freedoms while also safeguarding the public welfare. Nearly all states allow vaccination exemptions for religious reasons, and a growing number provide numerous opt-outs as well. However, in all but a handful of jurisdictions, neither objection is seriously documented or verified. Often, the law requires a parent to do no more than simply check a box indicating he or she does not wish their child to receive immunizations. The problem was exacerbated by financial incentives. Schools have to encourage students to opt out of vaccinations. The rise in parents opting out has caused the AMA grave concern, with many experts decrying the rise of so-called exemptions of convenience. In some areas, nearly 1 out of 5 children have not received their recommended vaccines. The consequences are serious not only for those unprotected children, but for the rest of society as well. Herd immunity is threatened as more and more parents free ride off of the community's dwindling immunity, and outbreaks of diseases thought to be concurred and have already occurred. Lawsuits against vaccine manufacturers threaten them with bankruptcy. Costs are being externalized into the healthcare and legal systems, and vulnerable populations are suffering harm or even death. In the interest of social welfare, state legislators and health departments should consider methods to ensure that the exemption process is carefully tailored to prevent check-the-box opt-outs for convenience, while still allowing exemptions for those with earnest or informed convictions or medical reasons. Other reasons include that they're thought to have caused autism, which is false according to research. Scientific studies continue to show that vaccines do not cause autism. The original article that sparked the fears and controversy years ago was shown to be fraudulent, and the lead author has lost his medical license. Since then, dozens of large studies of millions of children have found no evidence or a connection to autism. Another is thought to believe that they have mercury. However, vaccines have never contained mercury, a toxic metal that can accumulate in the body and cause brain damage. Before 2001, some vaccines contained thimerosal, a safe preservative made of mercury, and even then, prevent confusion, the FDA ordered that it can be removed from childhood vaccines. The flu vaccine, in a multi-dose vial, still uses it, although thimerosal-free versions are available. However, vaccinations against life-threatening diseases are one of the greatest public health achievements in history. Literally millions of premature deaths have been prevented, and countless more children have been saved from disfiguring illnesses. While vaccinations carry unavoidable risks, the medical, social, and economic benefits they confer have led all 50 states to enact compulsory childhood vaccination laws to stop the spread of preventable diseases. I believe this is one of the most crucial topics to talk about in society today because it can affect all of us based on someone's poor choices. Vaccinations are so incredibly important that I agree with Mayor Blasio. If your children aren't being vaccinated, that is the parent's responsibility that they do so and should be punished for it. For that parent to be so reckless in endangering the life of their child and endangering the other possibility of children getting sick because some children cannot be vaccinated due to medical reasons is incredibly selfish. This topic is something I feel incredibly strong about. It's our government's responsibility to make sure the public is informed on the importance of vaccinations, but with this growing trend in society, it is our job as neighbors, doctors, and virtually anyone who needs to be vaccinated. We need to create a sense of urgency that it needs to be done.